Myanmar's transformation has been rapid, to say the least, from pariah state to fledgling democracy. But reformers fear ethnic violence threatens to undermine everything they want to achieve. One woman has spent the past 20 years treating those fleeing the country and seeking refuge on the Thai-Myanmar border. However, the Australian government has cut off support for Dr Cynthia Maung's clinic, and her work is now in jeopardy. Oscar Sabakti reports.
Myanmar is changing. Reform has been underway in the country since 2010, when military rule was replaced by a civilian government. Part of the process has been the government's attempt to reach out to Myanmar's ethnic minorities. Over the last 3 years, President Thein Sein has forged peace agreements with the country's major ethnic groups after decades of conflict between rebels and the military. The clashes have uprooted thousands of civilians, with many fleeing into neighbouring Thailand or seeking refuge on the Thai-Myanmar border. It's here that Dr Cynthia Maung set up the Mae Tao Clinic in the border town of Mae Sot. Dr Maung left Myanmar after the deadly pro-democracy uprising of 1988, which ended in the declaration of martial law. Fleeing to the border with Thailand, she and other health workers set up a makeshift clinic to treat the growing number of refugees who had also escaped the fighting. Many were suffering from malaria, respiratory disease and diarrhoea, as well as gunshot wounds and landmine injuries. In its first year, the Mae Tao Clinic treated 2,000 people. That number has now swelled exponentially.
Last year, we see more than 100,000 patient caseload, so almost 50% of population are undocumented migrant or migrant laborers who are working in Thailand, and another 50% they come across the border to access health service at the clinic. So we see all health problems.
Dr Maung says many who have fled ethnic violence are afraid to return to their homes, with some spending years and even their whole lives living on the border or within Thailand itself. And that's despite Myanmar's ceasefire deals signed in 2011 and 2012 with rebels from the Karen and Shan ethnic groups, as well as Chinese brokered talks with Kachin rebels earlier this year. The Australian government has been a major supporter of Dr Maung's Mae Tao Clinic until now. For the past 3 years, around a quarter of the clinic's budget came from Australia's aid agency AusAid, which was integrated into the Foreign Affairs Department this month. But in July, Australian officials told the clinic its annual funding of around $500,000 would not continue past the current agreement, which ends next month. Accepting this year's Syd Peace Prize, Dr Cynthia Maung made a direct plea to the Australian government.
We are very surprised and disappointed with the decision, and I ask them to reconsider. This move has made things difficult and stressful for us because we cannot start turning away vulnerable people who have nowhere else to go.
The Mae Tao Clinic managed to secure the AusAid funding with the help of its Australian partner, Union Aid Abroad, AFIDA. It's echoed Dr Maung's calls for the Australian government to reverse the funding cut.
Through this money that's delivered through Australian Aid, 45,000 people per year receive life-saving and important medical operations and treatment through Dr Cynthia's clinic. It's not the time to withdraw funding to the Thai-Burma Border Services because simply Burma does not have a developed health system.
In a statement, Australia's Foreign Affairs Department says it's increased support for refugees on the Thai-Myanmar border. But it says a proposal to continue funding Dr Cynthia Maung's Mae Tao Clinic was unsuccessful because it didn't align with the objectives of the new aid program in Myanmar, and that its services don't reach as many refugees as those of other organisations.
Dr Nicholas Farrelly from the Australian National University says the government here appears to be refocusing its aid efforts in Myanmar.
The new focus, naturally enough, given the rapid political, economic and social transformation in Myanmar itself, is to try to get projects up and running on an unprecedented scale inside the country. That means that those who've been so crucial to providing humanitarian assistance along the Thailand-Myanmar border are facing some much tougher times.
Dr Cynthia Maung says she hopes to see a day when the services of her clinic will no longer be needed by the thousands of people who have fled ethnic violence. But she says that time isn't now.